Most executives who have a heart attack don't think that they're at risk. Their blood work often looks normal, they're still performing at a high level, and nothing feels urgent. But after seeing this pattern in well over 10,000 patients, I can tell you that the warning signs are there. Warning number one, you cannot switch off. If I sat down with your spouse and I asked her or him whether you're able to relax, what would they say? Because one of the most common things I hear from executives is, I know I should slow down, Dr. Kelly, I just can't. They're often checking email at dinner, they're thinking about work in bed, or they're technically on vacation but mentally still in the office. And most people see that as a good thing. They call it commitment, drive. But the problem is your body doesn't know the difference between a real threat and a never-ending workday. It just knows it's being asked to stay alert, hour after hour, day after day, and at some point your body stops recovering. Blood pressure goes up and stays up higher than it should. Stress hormones stay up as well, and your heart never gets a chance to take a break. When I look back at the last year or the year before cardiac event, this is one of the problems that I see, or one of the patterns that I see over and over again. The person who cannot switch off is not working smarter than everybody else. Their cardiovascular system is working harder than it is supposed to around the clock, and eventually the heart will pay the price. So let me ask you something. When was the last time you went an entire evening without checking your phone or thinking about work or solving somebody else's problem? If your answer is, I honestly don't know, pay attention, because the next sign usually shows up right alongside this one. Warning number two, your sleep changed. Nobody ever tells me that their sleep got bad overnight. What they tell me is that their sleep changed. They started waking up earlier, or they started waking up in the middle of the night. Or they could still get 7 hours of sleep every night, but they never felt rested or recovered when they woke up in the morning. And because the change was gradual, they didn't think much of it. They blamed stress, they blamed age, and they blamed a busy season at work. Now, all of those things can affect sleep. But here's why I pay attention when an executive tells me this. Sleep is when your cardiovascular system recovers. When you sleep very healthy, your blood pressure will come down. Your heart rate slows down. The entire system gets a chance to reset. But when your sleep starts getting lighter or shorter or more fragmented, then the recovery process starts breaking down. And the scary part is that many successful people adapt to that. They just tell themselves this is just how life is now. Meanwhile, the body is sending a very different message. One of the most consistent patterns that I have seen is that people often notice sleep changes long before they noticed anything else. That could be long before chest pain, before a diagnosis, before a cardiac event like a heart attack. Looking back, they can usually pinpoint when it started. They just never thought that it mattered. So let me ask you, compared to a year ago, is your sleep actually the same? Or have you accepted a version of your sleep that you know isn't as good as it used to be? Because the third sign is another thing successful people tend to explain away. And it might be even more common than the first two. Warning 3. You stop doing the things that you used to do to keep you healthy. 5 years ago, what did you do regularly that made you actually feel better? Maybe you went to the gym, you went running, or you played golf or tennis or went hiking, or you took long walks with your spouse and with your family. Maybe it was dinner with friends outside of work. Now, ask yourself, are you still doing it? Because one of the most common patterns that I see in executives is that the healthier they become professionally, the less healthy they become personally. Gradually, work gets busier. The responsibilities increase. There's more travel, more meetings, more people depending on you. And little by little, the things that you used to keep you healthy start to disappear. What's interesting is that almost nobody notices it while it's happening, because every decision seems reasonable. Skip the workout, skip the gym, cancel dinner this week, take the call instead, stay late one more night at work. None of those decisions feels important by itself, but 5 years later, you're living a completely different lifestyle than the one that helped build your health in the first place. that even help build your success in the first place. And your cardiovascular system notices. Movement helps to regulate blood pressure. Exercise will help you process stress. Strong relationships with your family and with your friends helps to calm the nervous system. When those things disappear, the body loses some of its most powerful forms of protection. I've had countless executives sit across from me and say some version of it, but I used to be in great shape. And I believe them. The problem is that your arteries don't care what you used to do. They care about what you're doing right now. That's why I worry when people have stopped exercising, stopped connecting with other people and family and friends, and replaced those things entirely with work because they are becoming higher risk. So let me ask you, what's the thing you used to do consistently that helped keep you healthy? And when exactly did that disappear? Because the fourth sign is the one that surprises people the most. Most people don't connect it to heart health at all. Warning number 4. Your decision-making slowed down or got worse. This one catches people off guard because when most people think about heart disease, they think about chest pain. They don't think about decision-making. But over years, I have noticed something. Some executives will tell me they don't feel quite as sharp. They're still functioning, still showing up, still getting things done, but decisions take longer. They second-guess themselves more, and the problems that used to feel straightforward suddenly feel much heavier, and they cannot quite explain why. Most people will assume that that's burnout, or stress, or just maybe getting older. Sometimes that actually is, but not always. Here is what most people forget. The brain is incredibly demanding. It needs a constant supply of oxygen and nutrients to perform at this very high level. And every bit of that supply depends on how well your cardiovascular system is working. When your sleep is disrupted, stress is chronic. The blood pressure stays high and recovery disappears. So the brain will often start showing signs before your heart does. That might include thinking more slowly, difficulty finding words, poorer judgments, more indecision, less mental stamina. I've had conversations, in fact, with spouses, business partners, and colleagues after somebody has had a cardiac event. And I hear the same thing over and over again. He just wasn't himself, Dr. Kelly. Not sick, not obviously unwell, just different, less decisive, less present, less sharp. And when we look back, that change had often been there for months, sometimes even longer. That's why I pay attention when a high performer tells me they are not thinking the way they used to. Because sometimes the issue is not motivation. It isn't discipline. It's not the mindset. Sometimes the brain is telling you that the system supporting you is under strain. Reduced decision-making quality in a high performer is the brain telling the heart that it needs attention as soon as possible. So let me ask you, compared to a year ago, are you making the decisions with the same level of clarity and with the same confidence? Or does it feel like you're working harder to get to the same answer? Because the fifth sign is the one almost nobody talks about. And it may be the most important one on this list. Warning number 5. You became more isolated without noticing it. This last one doesn't show up on most heart health checklists, but after 20 years, it's one of the things I pay the most attention to. Let me ask you something. Who do you spend time with when you don't have to? For a lot of executives, the answer to that question starts getting smaller over time. Life just narrows. Work gets bigger. Relationships get pushed to the side. Lunches stop happening. Phone calls become less frequent. You still see other people at work all day long, but somehow you end up feeling less connected than you used to. And because that happens very gradually, most people never think of it as a health issue. They think of it as a focus, focusing on the job, or efficiency, or the price of operating at a high level. The problem is that human connection is not optional for the nervous system. It is part of how we recover. When you spend time with people you trust, your body responds differently, your stress comes down, the nervous system settles, and recovery becomes easier. Take that away, and then your stress response will tend to stay more active longer than it should. That's one reason I often see these warning signs come together. The person who cannot switch off starts sleeping really poorly, and the person sleeping poorly stops exercising. And the person who stops exercising starts withdrawing from other people. Not because you want to, but because they are running out of bandwidth. And then the cycle feeds itself. One thing I have noticed over the years is that the executives who make the biggest improvement in their health don't just change their diet or start exercising again. They reconnect with their friends, with their spouse, with their family, even with themselves, and with the people who matter to them. And when you do, a lot of the other pieces will start moving in the right direction too. So let me ask you one final question. Compared to a year ago, do you feel more connected to the people who matter most, or less connected? Because if it's less, don't dismiss that as a lifestyle issue. It might be telling you something important about your health. A senior executive who has pulled back from the people around them is not more focused. They are showing a cardiac risk factor that no corporate health screening in the world is currently measuring. What to do tonight? If you recognize yourself in several of those signs, don't think of them as 5 separate problems. They're usually coming from exactly the same place. Your body is spending too much time in stress mode and not enough time in recovery mode. And tonight, I don't want you to focus on fixing all of this. I want you to focus on one thing, creating 10 minutes when your nervous system knows that the day is over. Most executives never do this. They finish work, check their phone, answer one more email, scroll for a while, and then expect their body to instantly fall asleep. It doesn't work like that. Your body needs a transition. And so this is what I want you to do tonight, starting right now. An hour before you go to bed, put your phone away. Turn it off. Leave it outside your bedroom. And then spend 10 minutes doing something that tells your body it is safe to go to sleep. It is safe to stop doing everything you've been doing all day. Take a walk. Read a book. Talk to your family. Talk to your spouse. Sit outside for a few minutes. Say a prayer, maybe of gratitude. Write a note in your journal of the positive points from your day and smile. The activity matters less than the signal. The signal is we're done for the day. Because when people start to improve their cardiovascular health, one of the first things that changes is recovery. The sleep gets deeper, much better quality, waking up recovered. Stress comes down. The nervous system becomes less reactive. And those improvements tend to show up before anything changes on a blood test. So don't worry about fixing your entire life tonight. Just create 10 minutes where your body gets permission to stop performing and then see what happens over the next 7 days. Those 5 signs are not stress symptoms to push through. They are cardiovascular signals. And every executive who has sat across from me after a cardiac event recognized them in hindsight. You are now seeing them in foresight. If you lead a team and you want them to hear this before someone amongst them has an event, I work with organizations directly on exactly this. And if you want to understand why fixing the artery is only half of the job, my first video is on the end screen now.